Old age is the stage when the body naturally begins to age, bodily functions gradually decline, and the risk of developing serious illnesses increases. Among them are diseases that not only affect quality of life but are also the leading causes of death among the elderly worldwide. According to medical experts, the mortality rate in people over 65 is mainly due to chronic diseases and non-communicable illnesses. Many of these conditions can silently progress over the years, only showing clear symptoms when they have become severe, making treatment and recovery more difficult. In today's video, we'll explore 8 of the most common and dangerous diseases in the elderly, ranging from cardiovascular conditions, stroke, and cancer to seemingly simple accidents like falls. Early recognition, proper prevention, and maintaining a healthy lifestyle are the keys to increasing longevity and living a healthier life each day. Don't skip this, because this information could save your life or that of someone you love. 1. Cardiovascular disease, the silent killer of the elderly. Cardiovascular disease is the leading cause of death among the elderly worldwide, accounting for over 30% of all deaths in people aged 65 and older, according to the World Health Organization (WHO). This group of conditions includes various forms such as coronary artery disease, heart failure, arrhythmia, high blood pressure, and myocardial infarction, heart attack. As we age, blood vessels become stiffer and narrower, forcing the heart to work harder to pump blood. This often leads to problems with blood pressure and circulation. In addition, high cholesterol, diabetes, physical inactivity, and a diet rich in salt and saturated fats significantly increase the risk of cardiovascular disease in older adults. What makes it more concerning is that heart disease often progresses silently over many years and is only detected when severe complications occur. Some early warning signs may include chest pain or heaviness, shortness of breath, especially during exertion, unexplained fatigue, swollen legs, dizziness, rapid heartbeat. However, many older individuals mistakenly attribute these symptoms to normal signs of aging, leading to delays in diagnosis and treatment. Serious complications of cardiovascular disease may include heart attacks, acute heart failure, stroke due to heart conditions, and sudden cardiac death. These events often happen unexpectedly and can have devastating consequences, sometimes without enough time for emergency care. How to prevent cardiovascular disease in old age. Monitor blood pressure and blood sugar regularly. These are 2 of the most significant risk factors that damage the blood vessels and the heart. Regular monitoring and good control can prevent the disease from progressing. Eat a healthy diet. Prioritize vegetables, fruits, fatty fish, and whole grains. Reduce salt, sugar, processed foods, and unhealthy fats. Exercise regularly. Older adults should maintain a routine of walking, slow cycling, yoga, or Tai Chi for at least 30 minutes a day. Have regular cardiovascular checkups. Echocardiograms, electrocardiograms, ECGs, cholesterol tests, and consultations with cardiologists help detect risks early. Maintain mental well-being and get enough sleep. Chronic stress and insomnia can put extra strain on the heart. Cardiovascular disease can be effectively prevented and managed if detected early and accompanied by timely lifestyle changes. Think of your heart as the central engine of life. Protecting it is the best way to live longer, healthier, and fully enjoy your golden years. 2. Stroke or a sudden attack that threatens life. Stroke, also known as cerebrovascular accident, is one of the leading causes of death and disability in the elderly. According to medical statistics, about 3/4 of all strokes occur in people over the age of 65, and the mortality rate from stroke in this age group is significantly higher than in younger individuals. A stroke happens when the brain's blood supply is suddenly interrupted, depriving brain cells of oxygen and nutrients, which leads to rapid brain damage. There are 2 main types of stroke. Ischemic stroke, accounting for about 80% of all cases, caused by a blood clot blocking the cerebral artery. Hemorrhagic stroke, caused by a ruptured blood vessel, leading to bleeding in the brain. What makes stroke especially dangerous is its sudden onset and often lack of clear warning signs. Here are some warning symptoms that elderly individuals and caregivers must pay close attention to. Facial drooping or weakness on one side of the body. Slurred speech, difficulty speaking, or not understanding speech. Sudden dizziness or loss of balance. Severe headache with no known cause. Blurred vision or sudden loss of sight. Time is brain. If any suspected signs of stroke appear, the patient must be taken to the nearest medical facility as soon as possible, ideally within the golden window of 3 to 4.5 hours, to increase the chances of survival and minimize long-term damage. Severe consequences of stroke, if not treated promptly, may include paralysis on one side of the body, loss of speech, cognitive disorders, poor memory, post-stroke depression, psychological issues, loss of self-care ability, full dependence on others. That's why stroke is not only a serious health threat, but also a major burden for families and society. How to effectively prevent stroke in the elderly. Control blood pressure, the #1 risk factor for stroke. Treat and monitor chronic conditions like heart disease, diabetes, and dyslipidemia. Avoid smoking. Limit alcohol. Eat a balanced diet. Exercise regularly to promote healthy blood circulation to the brain. Have routine health checkups and follow prescribed medications carefully. Though stroke can strike without warning, it is entirely preventable with the right knowledge and proactive health management. Remember, protecting your brain's blood vessels today is the key to preserving clarity and independence tomorrow. 3. Cancer, the silent enemy of old age. Cancer is one of the leading causes of death among the elderly worldwide. According to the World Health Organization, WHO, over 60% of cancer cases and 70% of cancer-related deaths occur in individuals over the age of 60. As people age, their risk of developing cancer increases due to weakened immunity, accumulated DNA damage, and prolonged exposure to harmful environmental factors. There are several types of cancer that are especially common in older adults, including lung cancer, often found in people with a history of smoking or prolonged exposure to pollution. Liver cancer, associated with chronic viral hepatitis or excessive alcohol use. Colorectal cancer, common in those with low-fiber, high-red meat diets. Prostate cancer in men and breast cancer in women incidence rises sharply after age 60. Other dangerous cancers often seen in the elderly include stomach, pancreatic, and bladder cancer. Early detection, the key to survival. Cancer in the elderly often progresses silently and can be mistaken for signs of aging or common illnesses. Some warning signs not to ignore. Unexplained, rapid weight loss. Persistent fatigue despite adequate rest. Loss of appetite, taste changes, frequent bloating. Chronic cough, shortness of breath, chest pain. Blood and stool, persistent constipation or diarrhea. Non-healing sores, abnormal lumps or swollen glands. Changes in the breast, prostate, or skin. Routine cancer screenings are crucial for middle-aged and older adults. Early detection allows for more effective treatment, lowers healthcare costs, and significantly extends life expectancy. How to prevent cancer in the elderly. While cancer risk can't be eliminated completely, older adults can actively reduce their chances by taking the following steps. Eat a healthy diet. Emphasize vegetables and fruits. Limit fried foods, red meat, and processed foods. Avoid smoking and limit alcohol consumption. Maintain a healthy weight and stay physically active. Get vaccinated, for example, hepatitis B to prevent liver cancer and HPV, if still within eligible age. Have regular checkups and undergo age and gender-appropriate screenings. Cancer can feel like a harsh sentence, but it can also be a battle with hope if detected and treated in time. For the elderly, paying attention to even the smallest changes in the body and seeking medical evaluation early on is the best way to protect their health, prolong life, and improve the quality of each day lived. For Alzheimer's disease and dementia, when memories begin to fade. Alzheimer's is the most common form of dementia, a group of brain disorders that affect memory, thinking ability, behavior, and the capacity to perform everyday tasks. Statistics show that 1 in every 10 people over the age of 65 has Alzheimer's, and this rate increases rapidly with age. It is the 6th leading cause of death among older adults in many countries, yet it remains one of the most underdiagnosed and undertreated conditions. Alzheimer's, more than just forgetfulness. Many people mistakenly believe that Alzheimer's is simply a natural part of aging or senior moments. In reality, it is a neurodegenerative disease that damages brain cells, causes brain shrinkage, and gradually destroys cognitive function. Early signs may include forgetting names of loved ones or recent events, repeating questions, struggling to find words, confusion about time or place, getting lost, even in familiar locations, difficulty managing finances, cooking, or self-care. As the disease progresses, individuals may lose their ability to care for themselves, communicate, or recognize family members, leading to total dependence on caregivers. This deeply impacts both the patient's quality of life and places a significant emotional and physical burden on families and caregivers. The importance of early diagnosis. While there is currently no cure for Alzheimer's, early detection and timely intervention with symptom-managing medications and brain-stimulating activities can slow disease progression and help maintain quality of life longer. Some methods used for early diagnosis include cognitive assessments using specialized tests, MRI or CT brain scans to detect brain atrophy, blood tests to rule out other causes such as vitamin B12 deficiency or thyroid dysfunction, preventing Alzheimer's and supporting brain health in older adults. Although genetics and aging are major risk factors, many studies show that a healthy lifestyle can reduce the risk of Alzheimer's. Older adults should keep the brain active, read books, play chess or puzzles, learn new skills, and engage socially. Exercise regularly to improve blood circulation to the brain. Eat brain-healthy foods, such as fatty fish, leafy greens, berries, nuts, and whole grains. Get enough sleep and manage stress levels. Monitor cardiovascular health, since heart disease can increase the risk of Alzheimer's. Alzheimer's and dementia can make life challenging, but with the support of loved ones and appropriate care strategies, older adults can still lead meaningful lives, cherishing every moment of the memories they still hold on to. 5. Chronic obstructive pulmonary disease, COPD, when every breath becomes a struggle. COPD, short for chronic obstructive pulmonary disease, is a group of chronic lung diseases, most commonly including chronic bronchitis and emphysema. It is the 3rd leading cause of death worldwide and has a profound impact on the quality of life of older adults, especially those with a history of smoking or long-term exposure to polluted air. How does COPD affect breathing? In individuals with COPD, the airways in the lungs become inflamed, narrowed, and lose elasticity, making it difficult for air to exit the lungs during exhalation. As a result, patients often experience persistent shortness of breath, especially during physical activity, chronic cough, often producing white or yellow mucus, wheezing, chest tightness, fatigue, reduced mobility, weight loss. In advanced stages, patients may require continuous oxygen therapy and lose the ability to perform even basic tasks like walking, bathing, or eating. COPD exacerbations, sudden worsening of symptoms, can lead to respiratory failure and death if not treated promptly. Main causes: smoking and environmental pollution. Over 80% of COPD cases are linked to tobacco smoke, including both active and passive smoking. Long-term exposure to cooking smoke, wood stoves, charcoal, occupational dust, or polluted air is also a major risk factor, especially for elderly individuals living in poorly ventilated urban or rural environments. Treatment and management of COPD. Although COPD is not curable, proper treatment can help manage symptoms, improve quality of life, and slow disease progression. Key approaches include bronchodilators and inhaled corticosteroids to open airways and reduce inflammation, home oxygen therapy for breathing support in severe stages, pulmonary rehabilitation, breathing exercises, and physical therapy to build stamina, vaccinations against flu and pneumonia to prevent infections that can worsen COPD. The most important step is to quit smoking immediately and avoid exposure to smoke, dust, and toxic fumes. Prevention: start with healthy breathing. Older adults can take active steps to prevent COPD by not smoking and avoiding secondhand smoke, keeping the living environment clean and well ventilated, wearing masks when outdoors or cooking with traditional fuels, exercising daily, especially gentle breathing exercises like yoga, qigong, or walking. COPD is a silent but dangerous disease due to its slow progression and subtle early symptoms. However, with early detection and timely lifestyle changes, seniors can still breathe easier, stay healthier, and enjoy a better quality of life. 6. Type 2 diabetes and its complications, the silent killer. Type 2 diabetes is one of the most common chronic diseases among older adults. It occurs when the body becomes resistant to insulin or doesn't use it effectively, leading to persistently high blood sugar levels over time. Alarmingly, diabetes often causes no noticeable pain or discomfort in its early stages, but over time, it can silently damage nearly every system in the body. Why are older adults more prone to type 2 diabetes? As we age, the body's ability to process glucose declines, and cells become less responsive to insulin. Common risk factors include a high carbohydrate diet, physical inactivity, weight gain, chronic stress, and genetics. Because it progresses slowly, many people are unaware they have diabetes until serious complications arise. Some early signs that are often overlooked include excessive thirst and frequent urination, unusual fatigue, blurred vision, unexplained weight loss, slow healing wounds, tingling or numbness in hands and feet. The complications of diabetes: far-reaching consequences. Without proper management, type 2 diabetes can lead to a wide range of serious complications that severely impact an older person's quality of life and life expectancy. Cardiovascular complications. Diabetes greatly increases the risk of high blood pressure, atherosclerosis, heart attack, and stroke. Kidney damage. Prolonged high blood sugar can damage the kidney's filtering units, leading to chronic kidney disease and possibly dialysis. Problems. Diabetic retinopathy may reduce vision or even lead to blindness if not detected early. Nerve damage. Patients often experience numbness, pain, or loss of sensation in the limbs. Diabetic foot ulcers are especially dangerous and can result in infection, gangrene, or amputation. Cognitive decline and depression. Studies have linked diabetes to increased risk of dementia and negative effects on mental health. Effective prevention and management of diabetes. Older adults can live well with diabetes if it's detected early and managed properly. Key strategies include healthy eating, limit sugar, refined carbs, and processed foods. Focus on vegetables, fish, lean proteins, and whole grains. Gentle physical activity, regular exercise, at least 30 minutes a day, improves insulin sensitivity and supports weight control. Medication adherence. Take prescribed medications on time and schedule regular checkups to monitor blood sugar, cholesterol, and blood pressure. Maintain emotional well-being. Stress can significantly affect blood sugar levels. Keeping a positive mindset is vital. Conclusion. Type 2 diabetes is a serious condition, but it can be effectively managed with the right knowledge and proactive care. For seniors, living a healthy lifestyle is the cornerstone of preventing complications and enjoying a long, clear-minded, and happy life. 7. Falls are a commonly overlooked danger among older adults. Falls may seem minor, but they are actually one of the leading causes of death and disability among older adults worldwide. According to the World Health Organization, WHO, millions of people over the age of 65 are hospitalized each year due to falls, many of which result in fractures, traumatic brain injuries, or even death. Why are older adults more prone to falling? As people age, their bodies undergo various physical declines that increase the risk of falls. loss of muscle mass and strength, reducing balance and slowing reaction times, diminished vision, making it easier to trip in poorly lit areas or over obstacles, unstable blood pressure, especially orthostatic hypotension, which can cause dizziness or disorientation when standing up, medication side effects such as drowsiness, dizziness, or impaired coordination from sedatives, sleeping pills, and blood pressure medications. Chronic illnesses like Parkinson's disease, diabetes, which can cause numbness in the feet, and arthritis all contribute to reduced mobility and balance. The severe consequences of a fall. Even what seems like a minor fall can have serious consequences. Fractures, especially hip fractures, are common and can leave the patient bedridden, unable to care for themselves, and vulnerable to complications like pneumonia or pressure sores. Head injuries, a strong impact to the head, can cause internal bleeding, coma, or death. Psychological effects. After falling, many older adults become anxious, lose confidence in walking, limit their activity, and rapidly decline in both physical and mental health. How to effectively prevent falls? Fortunately, falls can be effectively prevented with a few proactive measures. Gentle physical exercise. Activities such as walking, Tai Chi, and yoga improve balance, reflexes, and muscle strength. Home modifications. Remove tripping hazards such as slippery rugs and exposed electrical cords. Install handrails on stairs and in bathrooms. Ensure adequate lighting throughout the home, especially in hallways and bedrooms. Regular health checkups. Screen for conditions that affect mobility, check vision, and monitor blood pressure to identify potential fall risks. Wear proper footwear. Choose well-fitting, non-slip shoes with good traction. Balanced nutrition. Ensure adequate intake of calcium and vitamin D to strengthen bones and reduce the risk of fractures in case of a fall. Conclusion. Falls are a silent but serious threat that can be prevented with proper attention. With family support and simple lifestyle adjustments, older adults can live safely, confidently, and maintain their quality of life for years to come. 8 infections, a silent threat to older adults. Infections, especially illnesses like pneumonia, urinary tract infections, UTIs, and sepsis, are the 8th leading cause of death among the elderly, yet they are often underestimated. Due to a weakened immune system, older adults are more susceptible to infections and frequently exhibit delayed or atypical symptoms, which leads to late diagnosis and treatment, increasing the risk of serious complications or even death. Why are older adults more prone to infections? Age-related immune decline. Immune cells become less efficient with age, making it harder for the body to fight off bacteria, viruses, and fungi. Chronic illnesses. Conditions like diabetes, COPD, kidney disease, cancer, or immunosuppressive therapy significantly raise the risk of infection. Hospitalization or nursing home stays. These environments often contain antibiotic-resistant bacteria, heightening the risk of serious infections like hospital-acquired pneumonia or sepsis. Malnutrition and poor hygiene. Deficiencies in essential nutrients, especially zinc and vitamins C and D, impair the body's ability to recover from infection. Common types of infections in older adults. Pneumonia, one of the most dangerous infections. In seniors, it may present without a high fever and instead show as fatigue, shortness of breath, or a mild cough, often mistaken for other conditions. Urinary tract infections, UTIs, extremely common, especially among older women. Symptoms may appear as sudden confusion rather than the typical painful urination. Sepsis, blood infection, a life-threatening complication stemming from other infections. If not recognized and treated promptly, it can lead to multi-organ failure and death. How to prevent infections in the elderly. Routine vaccinations. Annual flu vaccine. Pneumococcal vaccine to prevent pneumonia. Shingles and COVID-19 vaccines if needed. Boosting natural immunity. A well-balanced diet rich in vitamins C, D, and zinc. Adequate sleep, stress reduction, and regular light exercise. Personal hygiene and clean living environments. Frequent hand washing. Good oral hygiene and proper skincare to prevent bacterial entry. Regular health checkups. Early detection of infections and associated risk factors through routine screening. Conclusion. Whether mild or severe, infections can pose serious health risks to older adults if not treated promptly. Raising awareness, strengthening the immune system, and taking preventive actions are key to helping seniors maintain good health and avoid the devastating consequences that infections can bring. Video summary. Old age is a vulnerable stage of life, and the 8 leading causes of death, including heart disease, stroke, cancer, Alzheimer's, COPD, diabetes, falls, and infections, can silently erode health and quality of life if not recognized and prevented in time. The good news is that most of these conditions can be managed, and their risks minimized through a healthy lifestyle, regular health checkups, and the right knowledge. A balanced diet, consistent physical activity, proper management of chronic conditions, timely vaccinations, and a positive mindset are powerful medicines that help seniors live longer, healthier, and sharper lives every day. Share this video with your loved ones, and don't forget to subscribe to Elderly Tips with Travis to continue this journey of proactive and joyful senior healthcare with us.